Fantastic. Thank you so much. Now, as we have a few new faces here today, I would like to remind you that we have an amazing calligrapher who is to my left. So when there's a break or over lunch, you can go visit the calligrapher and get some artwork done. So our first session is a fireside chat. The theme of it is Global Health Workforce, International Cooperation to Address Shortage. And I'm pleased to introduce the moderator, Steve Gardner, who is Managing Director of Healthcare World.
Thank you very much. Good morning. So here we are on day 3 after 2 days of, certainly from my point of view, some really, really enjoyable conversations. I don't know how many of you have been here for the last 2 days, but I think I've chaired 4 or 5 different conversations that have been so interesting and so insightful and so much fun to actually moderate. But I've been looking forward to this one because about 8-9 months ago, I travelled to Riyadh for the big global health exhibition, which I hope I'll see so many of you at in about a month's time. And I was introduced to my next guest on the Saudi Commission for Health Specialties stand. He and I had a brilliant conversation. We hit it off straight away. And he asked me to get involved in helping the Saudi Commission with their internationalisation strategy, of which he, along with Professor House and the leadership, is very much the architect of. So really looking forward to having a conversation about how that strategy came about, what it's about, and what's brought us all here today. So let me introduce Amjad Al-Ahmed. He's a really good friend, and I can't even pronounce his name. How terrible is that? Amjad, come and join me on the stage.
After all the hours we spent, you forget my name.
I know, it's disgraceful, isn't it? But there you go. So, I mean, first and foremost, this has been the culmination of a hell of a lot of work. How have you enjoyed the last 3 days?
Well, thank you so much, Steve. Once again, the last 3 days, including today, I believe they were informative. We've learned a lot from the experiences from different countries, different organizations. We are now more sure about our internationalization strategy, globalization strategy. And it gave us confidence on why New York side event happened. I'm looking forward to starting activating the collaborations we've discussed, many interesting ideas we've had with our guests. And I'm super excited to activate beginning with global health, starting on October 27th with many of our partners and partners-to-be.
And of course, you've also had the opportunity to have a sense of the real New York. On Sunday night, I took you to the New York Giants Kansas City Chiefs game. And do you want to tell everybody in the audience who your favorite player is?
Well, Steve picked the wrong game. So Scatterbo was the best player.
Scatterboom.
Scatterboom, as our friend from the behind line used to call him. And to put it simple, I think you've picked the wrong game. It was the Giants and the Chiefs, and I like the game after, way better.
What, when we were wandering around the car park and couldn't find the car to take us back to the hotel? Interesting that you mentioned it's a terrible game, because any New York sports fans in the room will know that the New York Giants starting quarterback has essentially been sacked after that game. He's being replaced for the next game. I don't know whether that was your influence, Amjad, but...
I mean, and even worse, we got lost for almost 2 hours looking for our driver. I mean...
Brilliant. But look, I mean, we met 8 months ago. I can't believe it's only 8 months ago. We've done so much together in that time. And I remember sitting on the stand at Global Health and you outlining for me the ambitions of the Commission and the strategy that you got. I mean, I guess the first question is why? Why the Saudi Commission woke up one morning, Professor House, and said, right, we need international collaboration. What was the thinking behind creating that internationalization strategy?
Well, actually, since the establishment of the Commission back in 1992, the Commission has built the expertise, knowledge, cumulatively over the past 34 years and plus. We believe that the Commission is a unique model in this world. I always tell this to our partners, that it's very easy for them to achieve their objectives and priorities, their KPIs from Saudi because the Commission exists. It's a one-stop shop for the regulators, for training centers, for even business partners. While it's really challenging for the Commission to do so in many, many countries due to the number of peers and entities who match the Commission's mandate. So, and as the strategy envisions empowering globally competitive healthcare professionals, you understand the complexity of achieving this vision. However, due and thanks to our sensible partners, we are able now to start activating our internationalization strategy. This is why yesterday I have urged each and every one of you. It all begins with the simple, candid conversations where you list your priorities and how we could reach a win-win situation. Some people, they do assume that just because they work for X or Y organizations, that the person they're talking to, he or she understands her scope of work, her mandate, her priorities. Cedars-Sinai, Mass General, RCPI, and many, many, many organizations. We're talking about more than 188 international partners that the Commission is actively engaging with. Just imagine the amount of work required to activate each and every agreement and business model. So this is why I said it all starts with the candid, simple conversations. See, all of the agreements that we have signed over the past 8 months, they all started with the simplest conversations. And that's it from my side about the excitement that the Commission is anticipating and during the upcoming global health and of course, the engagements beyond global health.
And I think there's a couple of things to pick up on what you said there. And I mean, the first thing for me is you're absolutely right. I mean, the Commission is a unique organization globally. I mean, I spend time in so many different countries, on so many different stages, talking about the same challenges in every healthcare system. But the Commission has a unique position as the regulator for all healthcare professionals under a single roof and responsibility for the postgraduate education and training elements of that. But I guess the question is, as I understand it, as we've discussed many times, there are really kind of 3 pillars to this, aren't there, in terms of, you know, looking at harmonization as we have, looking at exchange programs, looking at developing co-educational programs. Let's speak a little bit to those 3 pillars and how they form.
Of course. So since the launch of the strategy, 5 pillars are
3. It's 5.
You're working on 3 while we have. One pillar or 2 pillars I would emphasize on, which is the professional excellence, which is the core mandate and scope of work of the Commission, and scaling beyond borders. And New York's side event is one of the activities that directly answers to the KPIs in the scaling beyond border. The scaling beyond border, we have 3 main objectives, actually.
Oh, I got it right. There were 3. Good. Thank you.
This is what you meant. I mean, so the attraction of talents, as mentioned by Dr. Dina the other day. What do we mean, actually, by attracting talents? Saudi, unlike many of the consuming countries for health and care workers, yes, we are interested in attracting the talents, those who are interested to come and get educated or practice in Saudi. But also, we're one of the top countries exporting our talents and experts. We're talking about hundreds and thousands of doctors, nurses, maybe pharmacists who are practicing abroad, treating patients, working as the video over the last night's dinner, as you have seen.
I think, and the video last night, there were about 3 or 4 of those examples which are from outside Saudi.
Exactly. Second is the mutual recognition. So we're trying to reach reciprocity. We're not trying to replicate or harm the sovereignty of different countries, but rather, as mentioned by Dr. Muhannad, we're trying to reach or have a global credentialing framework, simply a reference that we could list at least the minimum expected qualifications, competencies required for each and every health specialty. Third and foremost is the exchange of programs. So many of our collaboration agreements, they do include the co-development of meaningful programs that could answer to healthcare professionals' needs in terms of competence, upskilling, etc.
And I think all of those things, in terms of the Scaling Beyond Borders strategy, speak to certainly my experience of working with you and in Saudi more generally over the last 5 or 10 years. I don't think there's any country in the world that I've visited where you have a friendlier, more open conversation.
Thank you.
You know, I think Saudi Arabians are...
It means you like our food.
I do like your food. You took me to an amazing restaurant in Riyadh last year that I will never forget. It was fabulous. But it's that thing about willingness to listen and willingness to learn, which I think is a wonderful element. But it's not just about listening, is it? Because the other thing that we have here, and we've talked about this a lot, is that we don't want this to just be a talking shop. It's lovely having a stage and graphics and, you know, great entertainment and lovely food as we did last night. But how are we going to turn this into action? How are we going to make this count?
Well, it's always easier when you have a lovely person such as you, Steve, to be taken care of. And actually, the Commission in Saudi Arabia, we have already put this in mind. So it's the third pillar. Mm-hmm. So the members' experience and belonging is the third pillar within the 2025-2030 strategy. So who are the members? The members are basically all the healthcare professionals registered at there are more than 750,000 healthcare professionals currently registered. So the Commission, we do understand when we are attracting the talents, when we are pursuing the development of the skills and the competencies of our healthcare professionals, it's not only about the quality of the programs, but rather it's a whole experience. So when a person decides to leave his home country, his kids, his family, and decides to reallocate to another country, the whole experience needs to be taken care of, meaning that you're not only promoting for your programs, you're promoting for your country, and you're trying to provide the best experience possible for those who have decided or at least showed interest to come and get trained or practice in Saudi. So this is really important. This is why the Commission isn't only working on uplifting and improving its programs, but rather we're trying to provide the best experience possible in terms of logistics, in terms of the interviewing process, in terms of even the matching. And for this, I do thank Dr. Maha for her contributions. We've bothered her with so many emails and follow-up meetings to get it done.
And the other element of that is creating these partnerships, creating these alliances with provider organizations, governments, higher education institutions, et cetera, et cetera. And I think at Global Health, you quoted a staggering number to me the other day, the number of agreements that you're going to be signing, because it's not just, like I say, talking about these things is great, but actually turning it into action. How many agreements? Give us a sense of the kind of organizations and the agreements you're going to be signing at Global Health.
So we're planning on having almost 40 to 50 agreements. But thank you for mentioning this, because I always remind our partners that, first of all, it's not about the number of agreements. Sometimes one agreement could change the trajectory of many healthcare professionals.
Like the Cedars-Sinai agreement that was signed yesterday evening. That's going to be a really impactful one, isn't it?
You mean RCPI? Yes. So Cedars-Sinai was signed.
Yeah, RCPI was last night,
Yeah.
but there's one with Cedars-Sinai as well.
Yes, exactly. So it's not about the number of agreements that we're going to sign. Yeah. It's about the quality of the outcomes and the activation. What worries me the most, always with our partners, is the activation element. Because you can sign as many agreements as you can, without proper activation, without proper communication between us and our partners, we sometimes end up with the signature and that's it.
And you've got, I mean, just to give people a flavour, we've got obviously Cedars-Sinai, the agreement's already in place, RCPI, so you've got Ireland, you've got the US. We're signing agreements with NHS England, I think, in Riyadh, with the Great Ormond Street Hospital for Children, one of the world's most famous paediatric hospitals. And of course, taking us back to the sports theme, Newcastle United.
I bought the jersey already. So.
Yeah. Which you've got your Swedish striker. Yeah.
Well, actually, I prefer Alan Shearer. So
Alan Shearer.
I know he's way beyond his prime time, and he resigned probably. But
yeah, he's a little bit pale to play up front for Newcastle now. But there you go.
I mean, as I said, we're looking forward not only for signing the agreements. So the agreements, they differ.
Yeah.
One agreement is different than the other. Some agreements, they help us in improving our systems. Others, they're basically exchange programs between experts in this world and the Commission. Some agreements, actually, the Commission is offering its expertise to some countries as well in the region and abroad. So I'm super excited, and I do invite each and every one of you. I highly recommend that you do consider attending this year's Global Health, whether you're a private sector organization or a public sector organization or an NGO. The Global Health is the wedding of all health conferences and symposia, not only in the region, but rather in the whole world. You will find pharmaceutical companies, regulators, international organizations. I think we're expecting more than 20,000 exhibitors this
And of course, we're going to be doing a networking event on the Sunday before the event starts.
I'm switching my mobile after New Year.
Yeah, and then of course we've got that, and we've also kind of put together an international round table. So I guess in closing, you've been everywhere in the last 8 months. Tell us the countries that you've been to. Where are you going next? And will you ever get to see your wife and children?
Well, I do miss my wife and children. That's a fact. We've been all over the world, whether it's me physically or my colleagues at the Commission. Everyone is serving based on his priorities and objectives. We've been to China, Thailand, Geneva, Dublin, and many Australia as well, France, many countries. And the reason why the Commission is doing so is basically, it's either you come and join us in Riyadh so that we do have our conversations and reasoning sessions so that we could together collaborate, or we seek after you and meet you at your home country. 2026 will be so different. We will be busy in activating the agreements, all the agreements we have signed in 2025. And I can't wait to see you all in Riyadh in October, perhaps 2026, or October 26th or 27th, which is the kickoff of the Global Health.
Because that, at the end of the day, is the message, isn't it? You can't scale beyond borders unless you're prepared to get on an aeroplane, go and meet people.
Absolutely.
Go and create these kind of relationships is what we're here to do this week.
Absolutely.
Amjad, we're out of time. Thank you so much.
Thank you,
It's been
Steve.
brilliant.
Thank you.
Thanks to Amjad. Cheers.